Can you guys hear me? Okay. Anyone?
Yes.
Yes.
Thank you.
Yes.
Thank you.
The people in the room probably, yeah, the people in the room probably can't hear us yet because I think they keep us off until they go live.
Testing, testing. Brian, can you hear me?
We can hear you.
We can hear you.
Thank you.
Yes, we can hear you.
Hello?
Hello.
Mhm.
Oh, yeah, I can use my gavel. What's that? No, right, and we have to officially not have a quorum yet. All right. You all good? Good morning. Good morning. Good morning. Good morning. I'd like to call the meeting of the board to order. Madam Secretary, will you please take the roll call vote? Thank you.
Director Bott?
Present.
Thank you. Director Curry? Is absent. Vice Chair Deere? Is absent. I believe he's on his way, but he is not currently present. Director Garza?
I'm present by phone.
Director Harrington?
Present.
Director Ryder?
Here.
Director Robinson?
Present.
Director Sorrell?
Present.
Director Story?
Present.
Director Webster Cross?
Present.
And Chair Taylor.
Present.
You do not have a quorum physically present. You have 4 members who are physically present, and the remaining are remotely attending.
Thank you. Given that, we will receive the items today as for information purposes only, and then we'll recess at the call of the chair. Okay? The first item on today's agenda, we will receive the CEO's report first and employee recognition. Okay, good morning, everyone. Thank you, Chair Taylor. Good morning. Good morning. We'll start with our new hires and promotions. We'd like to welcome our new hires, Jad Ayesh, Nurse Coordinator 2, Nurse Staffing Float Pool, Tamika Elzy, Director of Grants Accounting and Finance, Gregory Lee, Executive Director, Behavioral Health Care Redesign, Behavioral Health Services, Hidayat Ufomba, Nurse Manager Registry, System Float Pool, Diana Ulanowski, Director of Revenue Integrity, Revenue Cycle. We'd also like to congratulate several of our promotions, James Driscoll, Director of Patient Satisfaction and Employee Engagement, Patient Experience, Ashley Huntington, Privacy Officer, Corporate Compliance Administration, Aisha Ali, Social Service Manager, Behavioral Health Support and Expansion, Dr. Urjit Patel, Medical Director, Cancer Service Line, and Bridget Poston, Clinical Behavioral Health Manager, Behavioral Health Support and Expansion. We also have several awards and recognitions to run through today, which is a wonderful thing. And if you're in the room today, please stand and be recognized when we talk about your award. First, Stroger Hospital is recognized as one of the best hospitals for cancer care by the National Women's Choice Award. The Women's Choice Award is an objective, evidence-based quality designation based on CMS data and accreditation, and only 10% of hospitals in the nation receive this award. Congratulations to the Stroger team. We were also recognized for health systems with great simulation and education programs by Becker's Healthcare. We were one of 34 hospitals recognized, and this list recognizes programs that provide students and professionals with an opportunity to develop necessary skills in realistic yet controlled environments. It includes programs that offer cutting-edge technologies, lifelike scenarios, and safe environments that build provider confidence. We'd like to recognize our commitment to excellence award winners as well. Reginald Anglin, Stroger ED, Hippolito Rodriguez, Human Resources, Officer Tango Keith, Stroger Hospital Police, Beverly Jefferson, County Care, Shalonda Williams, Cermak Health Services, Tisha Johnson, Provident Hospital, Felicia Dixon, Stroger Hospital ED, and Nikisha Drain, Stroger Hospital ED. Congratulations to all of our award winners. Congratulations. Well done. We'd also like to share that Arlington Heights Health Center had a community open house on December 7th. We welcomed elected officials, community leaders, as well as current and prospective patients. CCH staff presented information about the health system's clinical services, financial counseling, WIC, public health services, and county care. And attendees took a tour of the building and met with the health center team. Big thank you to the Arlington Heights and Community Relations team for their great work coordinating the event. We also held on December 5th the Stroger Hospital Blood Drive. with the help of Commissioner Deere and Vitalint's Blood Bank. It was a very big success. The blood donated was estimated it'll help 81 individuals in need. Stroger Hospital is planning additional blood drives in the future, and big thanks to our team members who supported the efforts, including Donica Austin Cathy, Dr. Andrew Dennis, and Melissa Rowe. Next, we'd like to share that our Cook County Health Nursing Leadership Academy completed, and we had a celebration and graduation, marked a big milestone for empowering our CCH leaders with essential skills. Professional development program launched in March of 2023, tailored and carefully designed for development and organizational needs for our nurse leaders at Cook County. Congratulations to all of our graduates. Next, I do think we have some people in the room for this one, so congratulations to our CCH team who were recognized for the at the Midwest Pain Society Conference. Lisa Seaman, Dr. Mark Mysick, Dr. Emily Zhao, Dr. Frank Urasic, and Benjamin Wynn. Their poster, Pearl, Pain Elimination Through Acupuncture Research and Learning in a Busy Urban Emergency Department, won first place at the conference. Congratulations. Wow. Well done. Thank you. Next, we have two of our team members who were recognized at NACO for high performance in the High Performance Leadership Academy. Congratulations to Kate Headland, Senior Communications Manager, and Linda Camp, Director of Operations, Correctional Health. This was a innovative 12-week program created to equip frontline county government professionals with practical leadership skills to deliver results for counties and communities. Congratulations. Congratulations. And while I don't think she's here this week, we do want to recognize Dr. Bina Peters. She received the award, Power of Nursing Leadership, the Joan L. Shaver Outstanding Illinois Nurse Award. She was recognized by UIC College of Nursing, and the award recognizes a nurse leader who's highly influential in shaping quality healthcare in Illinois. Congratulations, Bina. And last but certainly not least, Andrea Gibson was recognized by Becker's Hospital Review as one of 65 top health system chief strategy officers to know. Okay. All right, congratulations, Andrea. So we'll give two quick updates first on the Joint Commission survey, and I'll have Dr. Turner come and give a little bit, but I just want to brag about the team before I hand it over to Dr. Turner. I was just incredibly impressed with the outcome. I was there for most of the survey week, and the way everybody worked together, the Provident team, Dr. Turner's leadership in preparing for this, as well as the support from quality, from nursing, from our Ovation team, as well as IS and running the incident command, was very inspiring to see. So I'll hand the rest over to you, Dr. Turner.
Thank you, Dr. Thank you, Dr. Mercadis. Good morning.
Good morning, Dr.
Good morning.
We are very pleased how successful the Provident Hospital Joint Commission survey was. That success was a testament to the entire Provident team for contributing to high performance and compliance in their areas, as well as the system leadership and the great work of our quality team. The surveyors had some very positive comments during their visit. I'm going to share some of those with you. Physician engagement was recognized as one of the best the physician surveyor had ever seen. Incident command and regulatory readiness was rated as exceptional by the nurse surveyor. Antimicrobial stewardship was recognized by the nurse surveyor as a best practice program. Emergency management program was recognized by the life safety engineer as remarkable. There were 5 areas where the surveyors indicated they did not have any findings, and those are on the screen now. Of course, we are still awaiting the final report, but needless to say, those areas should be very proud of the work that they did and what they accomplished during the survey. Surgical services, sterile processing, had no findings indicated during our survey. The physician survey indicated that that never happens and speaks to the great work the SPD and ID teams and others have put together in the recent years. I'll also add that environmental care, life safety had no conditional findings. 75% of the hospitals receive a conditional level EOC or life safety finding. So that is quite an achievement as well. Next slide. We had a total of 16 findings, and those are the areas where they were found. 5 in environment of care, 3 in life safety, 3 provisional care, 1 medical staff, 2 national patient safety goals, 1 record of care, and 1 medication management. Next slide. And these are some of the findings that were included in those findings. And you can see that 1 was mixing of stored gas. Some were corrected on site, as the penetration seen above ceiling in the ceiling tiles, as well as the kitchen dry goods storage door not closing. And those, some of the others were not, and we'll have to address those. And that concludes my report, and I guess somewhat bragging about the results.
Thank you, well done. Yeah, please.
Yes, I happened to be there on one occasion, and what was really impressive, there were a number of things that were impressive, not only the fact that there were very few issues raised or concerns raised, but what was most impressive is the surveyors were there from JACO kept talking about how they were so impressed with what they had seen. And so it made me feel proud to be there based upon what they were saying. And the one thing that they commended the hospital on is the friendliness they were shown by everyone when they came through the door and everything that happened. So job well done.
Thank you.
Yeah. Okay, thank you, Dr. Turner, and we'll move to the second topic for the updates. And just a quick discussion around strategy planning and deployment going into the next year. So Andrea has done a lot of work around reducing all of the tactics across our strategic plan. We've done work around kind of right leveling, and then prioritizing the things that we really want to focus on in the next year. So in all, we've reduced from about 250 strategies on the main list into about 60 that we're going to drive focus on for the next year. Further prioritization is going to occur over the next year, much like the OpEx HRO structure. We're going to start building that out across the entire strategic plan, and then kind of develop that uniform approach across the entire strategic plan. So I'm happy to hand it, well, do you want me to kind of run through this next slide?
Yes, next
Okay,
slide.
all right. Debbie, can you put one more slide? Thank you. All right, so this kind of shows from left to right, high level, where we're starting from, and then it boils down kind of the approach that we're going to be taking across our entire strategic plan. So we start with our strategic pillars. We have 7, of course, in our strategic plan. Under that, we're going to develop objectives and key results, and there's a slide after this that Andrea is going to speak to that kind of shows how those all cascade out, but the objectives and key results kind of are statements of what we're trying to achieve and then the key results that are going to drive that objective. Beneath that, we're going to have the A3s that you all are familiar with from the QPS committee, but this will be obviously in a different area of focus. And then the catchball, there's a slide behind this that will show kind of that cascade out from the strategy level all the way out to the front lines, and then how we have the discussion coming back up. Visual management, as you've seen, kind of managing for daily improvement, kind of having that instrument panel of how we're doing on all of these things. And then lastly, loop closure. We have a biweekly strategy planning meeting. Our plan is to start running through these A3s in a very intentional way with our senior leadership team, so that we have open line of sight to all of these tactics at the strategy level for our system leaders. I can hand it off to you, Andrea. I don't know if you want to add anything here.
No, we'll go to the next slide. I'm Andrea Gibson, Chief Strategy Officer. So this slide shows you kind of how we will tackle each of the strategies. So the strategic plan is set at a high level, and what this helps us do is make it tangible and actionable and measurable. So you can see the objective and key results at the top, and how we would measure that, like the type of data we might utilize. And obviously you can't read that A3 document, but that gives you a sense of how we plan to organize these strategies. Next slide.
Can I ask you a question?
Sure.
I'm looking at this now, just to make sure I understand it. Is your role that you're gonna try to get to the 4-star is actually your, nursing communication? Is that the plan? You're gonna try to move to the 73rd percentile?
So,
Yeah.
so this is just an example of kind of how the process rolls out, but yes. So the objective is to get to 4 stars. One of the drivers that probably, juice worth the squeeze is improving that one piece, right?
That's what I'm looking for, the drivers. That's the
Exactly,
question
yes.
I'm asking.
So the key result is gonna drive the objective, right?
All right, next slide, Debbie. So as Dr. Makaitis mentioned, there's going to be a process for continual evaluation and taking the strategy to tactics, to problem solving and communication, and there'll be a little bit of a back and forth between those in order to accomplish the strategy. Next slide. So just wanted to take you through some of the strategies that we've initially highlighted as our focus points for the coming year. As Dr. Makaitis said, we took kind of the long laundry list of about 250 and whittled it down to what you will see on these slides. Now I will mention that, we've accomplished some of the items in the strategic plan already, and that was outlined in, I believe it was the October board meeting on some of the things we've done. So some of the 250 was whittled down by finishing them. Now the list we're starting with is the one that I'll walk through now. We also plan on continuing to prioritize so that we are focusing on getting the most critical items across the finish line or significant progress this coming year. So you can see under our quality pillar, the patient safety, clinical excellence, and quality, the focus is always to continue improvement in quality metrics, execute on daily hospital-acquired conditions compliance programs, expedite testing and resulting to facilitate more timely discharges, focus on the magnet journey for nursing, expand the national database of nursing quality indicators to provident and ambulatory, look at how we can mitigate top conditions that lead to premature mortality and morbidity, ongoing clinical documentation, expanding value-based contracting, maintaining top quality outcomes for county care, increasing health screenings for county care as well, and investing in our grant and research infrastructure. So one comment before I go on to the next pillar, there is some overlap of some items across the pillars that you will see, but they're intended to be complementary of each other. For health equity, there's a strategy to continue to expand the availability of language choices for patients. We would like to continue to leverage public health data to improve population health, identify additional pathways for justice-involved individuals, address gaps in behavioral health care, continue to focus on mitigating social risk factors that have an impact on health, focus on birth equity metrics as a way to reduce maternal and infant mortality, continue to implement the Change Institute initiatives, and also improve our MBWPE participation in procurement opportunities. Next slide. For workforce, talent, and teams, I think in summary, hiring process, retention, pipeline work, wellness, focus, performance management, and agency reduction, which overlaps, of course, with the fiscal resilience pillar. For patient experience, we are looking to continue to implement the compassionate journey and CI care, implement Press Ganey microsurveys, increase employee engagement scores, expand patient navigation, improve HCAHPS measures, nurse communication scores, and implement self-service scheduling for patients. For fiscal resilience, we want to meet our budgetary volume and service goals, continue the next phase of our revenue cycle turnaround plan, optimize our documentation, reduce our reliance on agency and overtime, and drive productivity to align with benchmarks.
On patient experience, could you elaborate on the compassionate journey and CI care?
I cannot. Would you like to, or?
Oh, sure, I can. And then Ling, if you want to add anything, please feel free to come up. But yeah, so there's been a rollout plan. We've had levels of engagement with nursing, certain tactics that we've rolled out in terms of nurse leader rounding, and then teaching the CI care behaviors, kind of our standards of behavior, to nursing. We've had rounds with physicians, so we're kind of making our way through the organization to get everyone trained on those concepts. Ling, if you want to.
Yeah, so with the compassionate journey, it's actually to remind our staff members that they are important and that they need to take care of themselves and consider their own well-being before they could be able to treat their patients. And so once your cup is full, then you could pour onto your patients. And the CI care is our standards of behavior. So we've trained over 3,000 of our employees how to treat each other with courtesy and respect, and also how to treat our patients with courtesy and respect.
Yeah, I assume these are terms that you didn't create, so there's probably background information on both of these somewhere.
Yes, so the CI care is something that when I worked at Stanford Healthcare was rolled out. Originally, Stanford, even though it's a well-known system, when I was working there, the HCAHPS was at 67%. And then we had a new CEO come in, and he made sure everyone was trained under CI care. And then our HCAHPS went up to 93% within 3 months. And so I see it myself, and so that's why I rolled it out.
You're looking for some background
Yeah,
information?
some background information on both. I think it would be helpful for us to see that, have a better understanding when it's presented in the future.
Mm-hmm.
Yeah, maybe, Ling, we can bring that maybe at the next patient experience update for QPS?
Yeah,
Okay.
yeah, we'll do.
Okay, great. Moving on to the next slide, Debbie, optimization, systemization, and performance improvement. The focus identified for this pillar is to continue work on streamlining administrative processes, increasing surgical volumes at both Stroger and Provident through some process improvement work, improve and increase patient empanelment at primary care clinics, maximize our scheduling, and increase utilization of the patient portal, virtual care, and direct booking, drive our length of stay metrics more towards national benchmarks, execute our capital improvement work, our computer refresh, and capital equipment plan. For growth, innovation, and transformation, we'll be working on long-term facility planning, continuing to expand subspecialty service lines. We have been working on a Provident growth strategy, and that will continue. We're renegotiating, restructuring our affiliation agreements, and increase county care ACHN impaneled members' usage of CCH as a provider. County care is going to continue to evaluate various products to help support members throughout their life cycle. And we will further develop the referral network so that we can maximize capacity where we have availability, execute on our ARPA-funded projects, develop a long-term growth plan for CCDPH that's already begun, explore new care delivery models, which we've already done some of, but we would continue that this year. Some examples include urgent care, retail clinics, home-based care, and virtual care expansion. We're also, this is a new one on here, but conducting readiness work for the proposed 1115 waiver from the state that would provide additional resources for a lot of our programmatic work, both for justice-involved individuals and those experiencing, social risk factor concerns. So that's what we have identified so far. As many of my colleagues have pointed out, it still is a lot to get done in a year, and that's why we were careful to say, we'll continue to prioritize as we go through this process. There will be some things that develop as more urgent than others, but this is where our starting point. So I'd be happy to answer any additional questions you may have.
Thank you, Andrew. Actually, I'll start. So you indicated prioritization. Is this list in priority order now?
It is not listed in priority order. We have taken the list of 250 and brought it, this is now less than 60.
Right.
But they're not like 1 through 10 under the bullet point.
All right. So I think it would be helpful to your point as we think through, you said we're going to prioritize to have us have a sense of what is being prioritized throughout. Like to your point, 1 through 10, these are the 5 we're focused on in each area, or some kind of rank order, so we get a sense of, okay, what is the thing that's most important?
Okay.
That'd be good.
Yeah, so our plan is to continue to bring this back to the board to kind of give the
And
updates on the strategic plan.
Right, so as you bring it back, say, last time we had a list of 10 under optimization, right?
Right.
As we reviewed that, we identified these are the 5 that we're prioritizing.
Yeah.
3 we're prioritizing.
So I think there's 2 crucial steps that now that we have kind of the boiled down list that we're going to have to work through. First is understanding kind of the workload on each senior leader, right? So, Aaron has things in quality that really wouldn't touch the quality team here at the hospital, right? So those things can happen concurrently. It's not 2 things on 1 person.
Right.
So kind of right placing all of those things is the first step. And then the second is going to be for the next calendar year to create a roadmap really to, say, okay, these things are going to be first quarter, go a mile deep, inch wide on those things, really execute, and then go on to the next thing, right? Instead of trying to boil the ocean and do, 250 things all at once, right? So it's really, that'll be apparent on the A3s that we'll be bringing, the strategy level A3s. You'll have on the Gantt chart, you'll see that rightmost kind of red, yellow, green area. You'll see kind of what we're focusing on now and what's grayed out, and then what's to come in the coming quarters. So,
Okay, no worries. Thank you.
Just to piggyback on what the chair commented on in terms of prioritization, 2 things I would like to add in addition in terms of refinement. I understand that what Andrea and you both have shared with us that you want to prioritize these initiatives, and I think that's obviously a great move, right? We all recognize that. Can you give us any idea about the timeline when you'll be able to come back with those top 4 or 5? Is that January, February, so that we would have a
Absolutely.
understanding? Because we don't want to do the whole fiscal year and then we get halfway through and say,
right.
Here's our list.
We haven't started. Right. No, absolutely. I would say probably a month or 2. We're going to spend the next few weeks kind of getting everything mapped out. Our plan for that entire structure through the A3s, all of the cascade, all of that, is to start with HR and fiscal resilience, those 2 pillars to build that out. It exists in patient experience and quality to an extent. It's what we bring to QPS. So to start expanding out beyond that, we're going to do those 2 next and then build as we go.
And just something else, this might not be practical this first quarter or maybe not this year, but I would turn to the Chief Financial Officer and ask the question, with respect to the prioritization of these initiatives, is there a way that you could share going forward the financial implication, the value added proposition relative to these initiatives as they fall to the bottom line? Is there some kind of way? I know it's not an exact science because some of the things like that Lynn shared with us regarding C1, it's hard to put a dollar value, but in general, if the executive leadership team could share with the board what you all perceive would be that financial implication of all this good work that you all will be doing.
I think for the ones, to your point, that more directly touch finances, absolutely, we could probably bake that into an OKR and say, you know, our objective is this, our, you know, the key result will be this from a financial impact as well. So yeah, we can absolutely kind of put that on the instrument panel.
Okay. Just as a thought for, like I said, not the first quarter, but give you opportunity to work through your prioritization and assess the actual impact of these initiatives sometime during this year.
Sure.
This upcoming year.
This upcoming year. Thank you. That's, you know, my pressure. Then you only have what, about 8 days?
We're in the new fiscal year, so.
Yeah, we'd like to acknowledge, Vice Chair Davis joining the meeting.
Thank you.
Thank you, sir.
Yeah.
And I apologize for my tardiness.
Yeah, as you look at this issue of prioritization, a couple of things occur to me that it's a long list. When you look at everything, it's a very long list. And there probably is some interrelationship because you might not be able to do something in one area because of something in another area. If that is the case, could you identify that? If there's some relationship between achieving one of these things that will be challenged because you have to do something else. The other thing that occurs to me in terms of prioritization, there could be some low-hanging fruit, and I don't know how you're going to determine prioritization, but I would like for the things that are low-hanging fruit not to be, maybe they won't be rise to the top, but how do you know, when you prioritize, we won't have any idea why you prioritize things and why those things are important. So it'd be helpful to know why these things rose to the level that they did. Not only what the priorities are, but how did you get to that and how we can better understand why these are priorities moving forward. And some of these will require some baseline information because I looked at a couple of things. And it would also be helpful to know what the baseline is where we are now so that we can measure progress moving forward.
Yeah, we can certainly walk kind of through the thinking as to how we prioritize and why. You know, there's to your point, right? There's the impact it'll have and the effort it'll take to kind of get it done. So there's going to be kind of a, you know, what's going to be high impact and, right, you know, lower effort. Those are kind of probably, you know, bubble to the top, right? Where if it's low impact and high effort, probably going to go on the back burner. So good.
But some things you might be able to do right away.
Right. We call those just do it. Yeah.
Okay, I have a couple questions. When I look at your strategy, one of the things that stick out to me that would be helpful, and with the goal in mind being getting the 4-star, correct? Okay, so if I look at, and I'm assuming your categories that you have, those are your drivers, and up under there, those are the specific tactical things that you're going to do.
So each category is a pillar in the strategic plan. Yes. And then some of the items below aren't quite at the tactical level yet. It still says like improve quality metrics,
Sure,
for example. But that would be the next level of what we would do as we operationalize these strategies.
Okay, what would be helpful for me to understand and may be helpful overall? When we look at the 4 stars, can we come up with somewhat of a formula to say each one of your different pillars will have this type of percentage to be able to get you there? Because what I see now, it leaves a major question for me is how you really get there, what's the real impact? Because you could go down, you could take one pillar and take 365 days and not achieve the objective, but you've done a lot of work. So now we start looking at the, I think it's the 80-20 rule and see what's really going to move the needle. A lot of, to the 4-star. Everything I said is about the 4-star. Every comment I'm making at this point is about how do we really do this, if that's the real objective, not to just spend 365 days talking about it, but if you really want to do it, how are we going to do it? And I understand this is a strategy, and I know we're at the 30,000-foot level. I get that. But understanding that roadmap for me, understanding that formula, how each one of these will help move the needle. Because if we look at the entire team, everyone's going to move at different points in time. But the question is, and this is where a couple of colleagues mentioned, I need to hand the ball to someone else. But whereas I may still have the strategy, once they get there, this point is going to happen. So from the strategy, I need to understand how it's really working together to achieve the objective. You got the right information, but now what's the real strategy for how do we do it? That's the part that I need to understand, the impact. The drivers, whenever I think about, and that's why I asked the question, because I get straight down to how you do this thing, how do you make it work. It may not be the most eloquent sounding, but I get the job done.
No, I mean, it is always a challenge with a strategic plan to not just have it sit on the shelf and, you know, turn it into actionable, tangible, work product, right? You know, we used the 4-star. I think that's the quality metrics are arguably probably the most important element of our strategic plan. And I think that's why we highlighted it as like how we would operationalize that and like how we track it and that kind of thing. But not every single one of these items on here ties back to that. So the waiver planning, for example, does not. I mean, perhaps the computer refresh has some kind of tangential impact on that, but not each one of these things doesn't drive that 4 stars. But the 4 stars is an important goal, and there'll be a lot of tactics that have to support that.
Yeah, so if I could add, so the 4 stars and by extension our leapfrog rate, very much, I would say almost all, if not entirely, live within patient experience and the quality pillars. Those 2 pillars are probably almost entirely driving star rating and leapfrog. And we kind of have that roadmap already. That's what QPS has been working on. I would be happy to share, you know, our data analytics team kind of took a look at, you know, the juice versus the squeeze calculation in terms of what are the actual key results that are going to drive up to actually move us forward in that direction. So I mean, we'd be happy to bring that.
That would be nice. Yeah. Thank you.
So if you haven't figured out, we like prioritization.
That is not apparent. Yeah, and I think going from 250 to 60 is a pretty good start.
No, it is. We appreciate it. Thank you.
Mr. Chair, could I ask a
please.
question? So I appreciate my colleague Dirk Robertson shared. I also think we have to be mindful of the balance between strategic direction and operational management in terms of this stuff, and say I agree with prioritizing, and we'd love to see that, and we can talk about this further in QPS committee as well. But I also want to ensure we're being sustainable and working towards the outcomes and experience, and not just the process, you know, that Leapfrog or others may have, because we want it to be sustainable. And then I would be curious about what's been tried before and the areas we prioritize and why it might not have been sustainable, so that we consider that, and then talk, as you all do, talking to those that are impacted by these processes as well as our patients, to help us, you know, inform getting it right for the long haul.
Yeah, that's a great point, and it underscores what we need to do as a next step, and that is really work to understand who will drive each of these strategies, what the bandwidth is for that individual and their teams, so that I think that's what's going to drive the conversation about, like, what can we do in tandem versus what do we have to do sequentially.
Thank you. I just have one simple request, Dr. McKay. Could you please share the slide deck this morning?
Yeah, absolutely.
In the package?
It'll be part of the e-packet that goes out just regularly after the meeting. I usually send all the materials after the meeting, one more time, and it's always included.
So we'll see. Yes. Thank you.
All right. Thanks, Andrea. That's the end of the report.
Thank you very much. It was a good report. Thank you. The other information to share is that we're releasing the board, the committee meeting dates for 2024. So that will be released later this afternoon for everyone. Given that, this is information purposes only. there are no questions, then, the meeting is recessed to the call of the chair. The meeting is likely to be reconvened in early January. Thank you all.
Thank you.
Okay.
Thank you. Mr. Jerry. How you doing? How you feeling?
Outstanding. Taking one day at a time. Hey, thank you, brother. Appreciate it.
Thank you very much.